Also trending today, can psychedelic medications treat depression in cancer patients? The results from a recent clinical trial on this very topic are promising. Some doctors say a single dose of magic mushrooms could help with the long-term mental health of cancer patients. In clinical trials, magic mushroom dosing sessions can last about 8 hours. Medical professionals say proper use of these medicines have been shown to be a cure for PTSD, addiction, fear of death for terminally ill patients, a decrease in suicidal thoughts, and can help with treatment-resistant depression and anxiety. Joining us now with more on the research is the conscious physician, Dr. Lida Fatemi. Doctor, it's so great to see you here in person.
Thank you so much for having me. And you know, this is groundbreaking that a physician is talking about mental health and psychedelic medicines. This has never happened before. So it's such a privilege to be here. Thank you so much for having me, sharing this information with the public.
Yeah, and we appreciate you. I know you're a very busy physician, taking your time out of your busy day to share this, because the clinical research going on right now is very promising. And not only is it promising, when you look at who's behind it,
right,
that's really telling. I mean, the FDA is in clinical trials right now. Hopkins, I mean, talk to me about what's happening in the world right now.
Yeah, absolutely. So let's start here, actually. I'm going to talk about, you know, just generally mental health. What we see, this is the timeline of life, right, simplified. So that end is birth, 50 years of age, and we're looking at, you know, death at age, like, let's say 90. If an individual has a traumatic event at age 10, they have a much more higher likelihood of developing PTSD, addiction, depression, anxiety, and suicidality. And right now, we're in the midst of a global mental health crisis. And so we know this. So this is like negative effects of a trauma that has not been resolved at a young age, with no psychotherapy, no community support. And we know that during the pandemic, because of isolation and many other things, number of child abuse cases went up, number of child torture cases went up. So it's very concerning for the next generations, like where we're going. Mm-hmm. So it's really important for us to look at novel therapeutics, because what we're using right now in medicine, I can tell you because I practice, I'm a hospitalist, I'm an academic hospitalist, and I see very ill patients with severe addictions to many different substances all at once, with severe PTSD and suicidality that come to me. And we have them on 5 different medications, antidepressants, anxiolytics, nothing is working. So it's very cool for me as a physician to know, oh, we're looking at these novel therapeutics, which are kind of ancient at the same time, looking at them from a scientific perspective, and seeing the effects that they're having is just incredible. So in this study, the FDA is doing a phase 3 clinical trial using MDMA, and the street name for that is Molly or ecstasy,
okay,
with therapy. With therapy, I want to make sure that our viewers just know that the therapy and life practices that we also talk about in my course, extremely important. It's not just the medication. So they're treating PTSD in our veteran population, who we know the debilitating effects of PTSD in them, and the immeasurable cost to the individual, to their family, and to the society at large. And so let's say this veteran at age 20, they had a very significant traumatic event. They develop PTSD, and for the next 30 years, they're in this terrible cycle
of like trapped. Okay.
Trapped, and you cannot get out. And with 1 dose of MDMA, I believe, they went therapy. They have seen that a percentage of these individuals, about 70% even, we're seeing that their PTSD is gone. I mean, it is absolutely incredible.
Miraculous sounding.
It's miraculous.
Miraculous. We don't have a ton of time, but I want to move to what happened with Hopkins, because this study was several years back, but very impactful.
Very impactful. So Johns Hopkins had a group of patients at the end of life, diagnosed with a terminally ill, diagnosis, metastatic disease due to cancer and such. And they had fear of death at the end of life. And of course, right?
I experienced that with my mother. She knew she was so sick, but her fear of dying was so strong. There was nothing we could do to comfort her.
Oh man, I'm so sorry to hear that.
Thank you.
That's terrible. And and as you know from direct experience, if you could give her something to change that for her, right? To resolve that anxiety.
Yeah.
And that's what they saw in this study. That was a double-blind control crossover study, giving a high dose psilocybin session one time with proper life practices and spiritual practices. And they saw that they no longer had the anxiety at the end of that.
That's incredible.
It's incredible.
It really, really is.
Yeah.
So is this becoming more mainstream? I mean, will we see it where, because I've read books about this, I'm fascinated by it, and I have for years now. Will it become mainstream? Because I hear that even like if a treatment when you get to middle age, when you almost become like a step and repeat, where patterns get stuck in your own head and it's hard for you to move on, and you've had a lifetime of this, probably a lot of what you're talking about here, but without maybe an attachment to being in the military or end of life. Will we have access to this?
I think so. What we're seeing is that Oregon legalized it completely. So, people can go in and use.
With the doctor?
I believe so.
Okay,
now,
all right.
I have to investigate the details. I don't know, but I know as a general, like statewide, they have legalized it. Again, I don't know what the little details, like with whom and
but clearly coming from a hospitalist like yourself who deals with patients day in and day out, you seem to subscribe to the fact that it should be under doctor supervision alongside therapy and lifestyle changes, as you've mentioned again and again, so people are actually getting this under the proper safety of an umbrella of people that are in the know.
100%. Proper use is the right dosage. You have to have a guide who knows what they're doing. It has to be supervised in a restorative environment with the right intention going into it, and follow-up. Follow-up is absolutely significant and essential in this. So you have to have psychotherapy, you have to have support from your community and family 6 months after, a year after. A lot of things are going to come up that you don't know how to deal with because these patterns have been broken all of a sudden. What are you going to do with all this information that you have now realized about yourself? So it's very important to understand, yes, these life practices are very important to get into and get rooted in prior to a session like psilocybin, and have the right environment and person to do it with, and follow up afterwards.
All right. I can't thank you. It's so great to see you in person. I know we've talked a lot via Zoom, but it's great to have you in studio, especially with such a topic that is so fascinating. I hope you'll come back.
Thank you. So I would be privileged to come back.
Thank you. And I will connect you to the Conscious Doctor on our website, wfla.com/Bloom. I know you're going to want to read more about this.